Welcome to an early edition of AirSculptTV today. Today we're going to do a man's abdomen in New York, and that's exciting because we haven't shown many men. So we're looking forward to actually encouraging our male patients to go ahead and show more men because men have unwanted fat too. Before we do that, I just want to show you, we did Adriana's arms, actually I did her arms, in Miami 3 weeks ago, and we just wanted to give you an update with her arms. This is her 3-week before and after. This is not her final result. What's important here is that you see that she has a noticeable change, and we'll post this so you can see it. Noticeable change, no bruising. She's actually been to Colombia and back since her procedure. She was on the beach, all kinds of stuff like that. And that's why she has a little bit more of a tan here. But what you can see is a change. You can also see, if you look at this area of her arm, you can see the skin is tightened up very nicely. There's not a sagging bulge anymore. And we'll give you updates with more photos, probably at 3 months. And I look forward to showing you the chin patient we did last week. So we'll give you an update with her interim before and after. So this is not a result, although there's a nice change. It's just the tip of the iceberg. Her arm will be so much skinnier the next time you see them. But I just want to show change. So anyway, let's go live in New York with Dr. Schaffner. We have a patient named Andrew, and he's getting his tummy done.
There we are.
Hello.
Hi, Dr. Rollins.
How you doing?
I'm good. How are you?
I'm great, thank you. Thanks for letting us join the procedure.
Of course,
Let's
we're
go
so
in the
excited.
procedure room and see what's going on.
Yeah, so we have Andrew. He's getting his full abdomen done. Come on in. Let's go.
Well, if it isn't Dr. Schaffner. How you doing, man?
How's it going, Doc?
Great. So you're Andrew, I hear.
Correct.
So how are you feeling right now? Can you point the camera better down at him because we can't see him?
I feel great. I mean, this is probably one of the most different things I've done, and it's hard to describe. It's pretty awesome.
I'm so glad that you're having a good time. Can you point the camera down better at Andrew so we can talk? So you're having AirSculpt done right now, is that right?
Correct.
Let's take a quick look at that and let's see his canister of fat.
So he's getting done. This is what we have so far. So we just started.
Okay. So you got about a beer can out of fat. When did we start AirSculpting you?
We just started a few minutes ago.
Oh, what? Just a couple minutes ago. That's great. Okay, well, let's talk to Andrew. And thank you, Dr. Schaffner, for allowing us into your procedure. We really appreciate it. And Andrew, it's an absolute honor to meet you, and thank you for giving us the privilege of being here and part of your procedure. So,
Well, of course.
very kind of you.
Thank you.
What I really want to know here is, first of all, what made you decide to get AirSculpt?
Well, I stumbled across you guys on Instagram, and so I was very curious, and then I saw it, and the procedure it's so streamlined, and it's something I really wanted to do. For years, I've had a hard time with my love handles. You know, as time you get older, you can't go to the gym as much. You can't do anything. You know, I can't donate 2 hours a day to the gym between work and everything. So I wanted to feel comfortable again.
I'm so happy to hear that. You know, so many guys go to the gym, they eat as well as they can. They go to the gym almost every day or exercise almost every day, and they don't feel comfortable in their skin. Their tummy isn't going down, or love handles. Love handles are notoriously hard for men to lose.
Yeah.
And, you know, one of the reasons I wanted to do AirSculptTV with you today is because there's so many men who could benefit from this, and we just haven't really marketed to them so much. We haven't told them, we haven't shown that many men, and we used to, but we just haven't recently. So I'm so happy that you could do this. because AirSculpt benefits men just as much as women. You know, fat is fat, and
Oh,
you know, someone like you who exercises all the time, and you can't get the result you want. I mean, this is going to get you there. I can be sure of that. What else I want to know is, what's your goal? Is there like something you want to do? Is there something you want to wear, or you just want to look in the mirror and feel great?
no, I don't want to have to wear black all the time. You know, black shirts, anything black hides. You know, it does a good job of hiding. You know, and I want to feel comfortable. You know, not have to go to a pool and leave a tank top on and get a farmer's tan. You know.
I love that. A white tank top, not a black one.
Yeah.
That's awesome. How did you find out about AirSculpt?
Like I said, I don't know how it popped up on Instagram, and then I just watched a couple of your videos, and you know the downtime was awesome. You know, I can't afford to be cooped up, you know, for 2-3 weeks after something like this.
Sure. Well, you're going to be able to go back to work tomorrow. I mean, absolutely. So, and we're going to get a lot of fat out of you. So we're doing the whole front of his tummy and his waist love handle area all the way around to the back. I mean, this is going to be a really, really nice change for you, and you'll be able to go to work tomorrow if you want to.
Yeah.
Yeah. So I'm really happy to join you. And what about music? What kind of music are you listening to today?
We were listening to reggaeton.
Reggaeton, huh?
Yeah.
I'm a reggaeton fan myself. Anyone in particular?
Nah, I love J Balvin. So I mean, he's one of the guys.
I'm a J Balvin guy, but I hear you. We're all in Miami, and you hear reggaeton wherever you go.
Oh yeah. No, I think if I get it done again, I'll probably go down and see you guys down there in Miami.
Cool. Let's look at his fat canister now and see how much more fat we got just since we were interviewing him. I want to see that. So we had about a quarter of a liter before. What are we at now? Julissa, are you in there?
Yep.
So we have over half a liter now. So we got, in just the time we've been live interviewing him, we doubled the amount of fat that was out of him. And as you can see, it's all yellow. And that's because AirSculpt is so minimally invasive, it's not hurting him. Andrew, are you in pain?
No, not at all.
What does it feel like?
It almost feels like one of those the back massager, you know, like, and then you just as if taking a back massager, rubbing it on my stomach.
That's what we hear a lot. And let's talk to Dr. Schaffner for a minute.
Dr. Schaffner.
Good morning.
How's it going?
We're doing great. How are you?
Great. Nice amount of fat out. It looks like
Absolutely.
you just started.
He's looking great.
Any thoughts about AirSculpt and men?
Well, I think that
do a lot of men.
Absolutely. I think that love handles and chins, the submental, are the two biggest areas for men, in addition to the beer belly. And
I agree. I think men benefit from their tummy and chin more than almost any other area, except male chest is really good to do.
And now it's going to be
love
one other
doing
one.
men's chest. It's called gynecomastia. It's super common. And
Totally,
we look forward to doing
totally agree.
one of those.
More and more men are doing procedures, and guys should not feel that this is just for women. About 15% of plastic surgery is now done on males, and people have seen Botox and things like that, but certainly it's not just for the minimally invasive injectables. We also have minimally invasive AirSculpt, and we're certainly able to go ahead and make a big difference in people's lives in a very short period of time. You can see just in the past few minutes, we've already removed about a half liter of fat, and we're just getting started here this morning.
Yeah, it's a great amount of fat for such a short amount of time. Let's go. Thank you, Dr. Schaffner. Let's go back to Andrew. Andrew, were you nervous about this?
No, I've had plenty of tattoos done. I've actually had, I've had 2 wrist surgeries, so this is a walk in the park, you know.
And I see your tattoos. What hurts more, AirSculpt or a tattoo?
The tattoo.
Okay, all right. I'm glad to hear that.
Yeah.
And now, someone's probably going to see you that if they say, should I do this, or would you recommend this to people that are watching?
I definitely recommend it. It's going to be the smartest decision I probably made in the last couple of years.
So happy to hear that. You know, I can't wait to see your after picture. I think you're going to have a really nice change in 48 hours. If you want to take a mirror selfie, go ahead. Otherwise, maybe we get an after shot of you around 3 weeks. I love showing the fact that AirSculpt will make you look skinnier today, right?
Yep.
It's not your final result, but you are going to have a result today on this table, and you're going to have that result for the rest of your life. So this is permanent, guys, and it's one and done. We're getting his fat out of his body, as you can see, and it's a beautiful thing. Thanks so much, Andrew, and thank you, Dr. Shaffield. We're going to answer some questions about abdominal AirSculpt, and I just hope you have a great procedure, and I look forward to hearing from you soon.
Thank you. I appreciate it.
So thanks for letting us join. We really appreciate it. Take care, guys.
Bye.
Okay, bye-bye. So let's answer some questions like we always do. Lauren can do the honors, and please, if there's any questions that came to your mind while you were watching Andrew have his tummy done, go ahead and ask about whatever you want, and Lauren will read it off. So go ahead.
Can I get a 48-hour six-pack?
Let's talk about 48-hour six-packs. So we invented the 48-hour six-pack years ago, actually right after Magic Mike came out, because so many guys wanted a six-pack. And we can do that. We can give someone, we can make their abs show in 48 hours. The key to a 48-hour six-pack with AirSculpt is you actually have to have abs. So if you have fat and there's abs underneath, we can show those abs off right away. And we'll give you extra definition down the middle and the sides, obliques, and it's wonderful. It's one of my favorite procedures to do. And especially that you can get those abs that you've been working for so long in the gym and in the kitchen for so long, and you get it in 48 hours. So it's an amazing procedure for the right patient. You have to have the abs there. We can't create abs that you don't have. So that's who works for 48-hour six-pack. In the case of Andrew, Andrew works out, so he'll probably have some abdominal definition. And someone asked how long the downtime is. Andrew can go back to work tomorrow. Almost every patient we have is able to go back to their normal life tomorrow, so the next day. So really there's no real downtime except the day of the procedure, because we give you medication. We don't want you doing driving or making any major decisions, operating other heavy machinery, etc. Go ahead, Lauren.
Can I also target my pubic area to create a flatter look?
Great question. So pubic in women and in men is a super important area. If you do the abdomen and you have pubic fat and you don't do it, it just doesn't look it doesn't look cohesive, right? You don't want to have everything is relative. The skinnier your stomach is, basically the bigger your pubic fat pad will look. The pubic area is super, super easy to do. It's fast. It probably takes 5 to 10 minutes. It makes a tremendous difference. Guys love to do it because that area, if you really don't want any extra fat in that area, especially you want it to match your tummy. Women do it more for bikini season. They don't want a bulge there if they're wearing a bikini or a bathing suit, or sometimes just yoga pants. I've seen a lot of patients, female patients, say they want to do their pubic area for because they wear yoga pants or Lululemon type stuff. So again, 5 to 10 minutes, great area to do, highly recommended.
Someone asked, does it tighten loose skin?
AirSculpt always tightens loose skin. With AirSculpt, your skin will never get looser, it will only get tighter. And we'll see that with Andrew, and we'll see that with every single patient. The patient behind me, even in 3 weeks, her skin in her arms is already much tighter. And that's why I love showing these interim before and afters, so you can see the development of her result. So this is the beginning of her result, and already her skin is tighter.
When can I take off my garment after I get this procedure done?
So when we do tummy procedures, we want you to keep the garment on for 48 hours. Now you can still wash yourself and stuff like that, but the first 48 hours are really important. Part of AirSculpt is getting the fastest result possible on the planet. The longer you wear your garment for the first 48 hours, the more it squeezes the fluid we put in out of you, It squeezes out extra dead fat particles, stuff like that. And when you take it off the first time, you should look in the mirror and be like, wow, okay, I want a wow result. And that's really important. So 48 hours for the tummy. Now, a lot of areas like the arms, 24 hours is fine. But for the tummy, because it's such a large area, it's basically the largest area we do, 48 hours, I think, is going to give you the fastest result.
All right. They're asking where the entry points are for the abdomen.
Oh, well, the entry points for the abdomen are kind of just below the waistline of your underwear, on either side of your hip bone, and inside your belly bone.
Okay.
Oh, and each hole is exactly that big, like I always show. You can barely see it, but it's 2 millimeters, or the size of your average freckle.
All right. Will this procedure help me lose weight?
Great question. Actually, yes. The more fat you take out, the more weight you lose. It's not a weight loss procedure, it's a body contouring procedure. So we'll make you look a lot skinnier, but you actually will lose weight. Usually people lose about double the amount that we remove. So my mom had her abdomen done, I don't know, 8 months ago or so, and she lost so much weight I barely recognized her. She's so skinny. But you know, a lot of people are very motivated after they get their AirSculpt procedure. They eat better, exercise more, walk more. So it's really like kind of a cumulative thing. All of these things build up, and you know, healthier lifestyle, etc. But yes, whatever we take out of you, you definitely lose that weight.
Someone's asking how much fat can be taken out from the abdomen.
Typically, we're in so many states now. Every state has its own rules, but on average, we can take up to 5 liters out of a patient's body at one time. So that's the average. That's the most common, and that's typically what we do.
Someone also asked if you could explain what the Power BBL is.
Well, Power BBL is the AirSculpt BBL. It's a BBL you get typically taking the fat out of the tummy, but the fat can come from anywhere. It could come out of your back, your waist, your inner thighs, your arms, or all of the above. And then it's transferred to your butt, but it's done so with our technology. It's done so using AirSculpt, no needle, no scalpel, no stitches, while you're awake, using AirSculpt cannulas, and we remove it so gently, we're removing the fat while it's still alive. You've got to transfer live fat when you're getting a BBL, or what we call an uppercut when you transfer it to your chest. If it's not alive when you transfer it, it will not last. And everyone here who's watching this who wants a BBL wants the fat to live. If it lives, that you'll have a lasting result. And that's really important. Also, with the Power BBL, there's no syringes. It's injected directly from our collecting bucket into your butt after it's treated with antibiotics. So we're not filling up a bunch of syringes. We feel like it's much safer that way, and actually much more artistic.
Okay. Someone asked if this procedure can be done on the chin.
Oh, it sure can. Please look at our chin before and after results. I think we should be doing so many more chins, because of any area, if you ever want to get fat removed, the chin, I think, has absolutely the most dramatic result and the fastest result of any area. Just taking like 2 tablespoons out of someone's chin can make them look dramatically different, skinnier. It's very motivating. And in older people, it almost makes them look like they have a facelift.
All right. We have someone asking, how long after giving birth can you book an appointment for the abdomen and chin?
Great question. So after someone has a baby, you can get anything you want done as long as you're not breastfeeding. Okay, so you can't have this done if you're still breastfeeding. But for a normal vaginal delivery, 3 months, and for a C-section, it's 6 months.
All right. Last question. I think that's about it, Dr.
Okay.
We just have some great feedback.
Thanks so much for watching. We really, really appreciate it. And thank you, Andrew, for sharing your results. Thank you, Adriana, and we look forward to watching your arms change and develop into the arms you always dreamed of. And thanks, everyone, for watching, as always.